In this video, we will study the difference between 5 terms: infection, SIRS, sepsis, septic shock, and severe sepsis. Now, what is infection? Infection is a condition when there is identifiable source of microbial insult. What is SIRS? SIRS stands for Systemic Inflammatory Response Syndrome. So basically, there are 4 criteria. If 2 or more criteria are fulfilled out of these 4, then we say it is SIRS. Criteria number 1, when temperature is more than 38 degrees centigrade or less than 36 degrees centigrade. In terms of Fahrenheit, you can say it as 100 degree Fahrenheit or 96 degree Fahrenheit. Okay? Criteria number 2, if the pulse rate or the heart rate is more than 100 beats per minute. It is more than equal to 90 beats per minute. If there is abnormal WBC count, that is WBC count going above 14,000 cells per microcube per microliter, or if it is less than equal to 4,000 cells per microliter of blood. And the 4th criteria is the respiratory rate. If the respiratory rate becomes more than equal to 20 times per minute, then or if the PaCO2 is less than equal to 32 mm of Hg. So if any 2 of these 4 criteria is fulfilled, we say that the patient is in SIRS, that is Systemic Inflammatory Response Syndrome. Temperature, heart rate, respiratory rate, and abnormal WBC count. Now, sepsis is a condition of infection plus SIRS. And what is severe sepsis? It is sepsis plus organ dysfunction. And septic shock is sepsis plus cardiovascular collapse. So I hope the difference and the meaning of these 5 terms are clear. We can make it clearer by looking at one example. Let's look into the example. So there is a 76-year-old male who is a known case of type 2 diabetes mellitus, and he is in uncontrolled condition. His random blood sugar is 360 milligram per dl. He is having a diabetic foot infection of right side, plus there is super added cellulitis. Now tell me, what is this? And the temperature is 102 degree Fahrenheit, pulse rate 110 times per minute, and respiratory rate is 30 times per minute. So you can see that this is a condition of sepsis. Why? Because I have identified infection 1, because there is diabetic foot infection and superadded cellulitis. And there is also features of SIRS. Temperature is more than 100 Fahrenheit, pulse rate is more than 90, and respiratory rate is more than 20 times per minute. So SIRS is also present. And I told you that sepsis is SIRS plus infection. So the first case is sepsis. Now on the day 2 of admission, you see that SpO2 has gone to 90%, which is wrong. Urine output is so less, 0.3 ml per kg per hour. Serum bilirubin has increased to 5 milligram per dl. IPS is absent. That is interstitial peristaltic sound is absent. Platelet count is reduced. That is 1 lakh. And FiO2 has increased. So this patient, the day 2 of admission, has gone to sepsis, severe sepsis. Because you can see the features of organ dysfunction. That is, hepatobiliary system has gone wrong, respiratory system has failed, renal system has failed, where you can see the urine output. So it is sepsis plus organ dysfunction, that is severe sepsis. Now you've admitted the patient to ICU, and you can see that hypotension is there because mean arterial pressure is less than 65 mmHg. So here cardiovascular collapse is present, hence this is septic shock.